all started to incorporate that in our practice years ago. And guess what happened to our case acceptance?
Went up.
And not like a little bit. It went up geometrically. As you're presenting your treatment recommendations, let the patient know the consequences of what is likely to happen if they don't do anything. Let them know what might happen if they don't do anything. That's part of informing the patient. And what we've learned is that, you know, some people in the world respond to moving towards something that they want. Other people respond better to avoiding something they fear.
Right.
And the analogy I love to use is Usain Bolt, you know, the Olympian sprinter from Jamaica.
Yeah.
If Usain Bolt, put him in two situations. One situation is Usain Bolt is in a competition with other world-class sprinters, and the winner of the race gets a medal. That's one situation. Move towards something that you want. You want the medal. The other situation is Usain Bolt is being chased by 6 Rottweiler dogs with rabies. Which situation is Usain Bolt going to run faster in?
Definitely when he's chased by the rabies. I mean, if you look at our world today, right? Insurance, the pharma, right? Everything is the second, right? It's not really moved towards, it's, you know.
Well, let me give you an example.
Yeah.
Now, let's say you're missing a second molar in your upper left.
Okay.
Yeah, and you know, clearly one of the concerns, we're going through the video tour, you have a missing tooth up here, Naren.
Yeah.
And you might say, yeah, I know, I lost that tooth 5 years ago. Yeah. I mean, and the doctor can say, do you have any interest in addressing that missing tooth? And we might say, you know, let me tell you, you don't have to do anything about that, but we do have options that are really good options if you'd like to have that replaced. But I do want to share with you one of the possible consequences of not doing anything. So one of the possible consequences, narrative, of not doing anything is that the teeth are going to shift, because now we have that space and the teeth will shift and move. And over time, it could lead to the loss of other teeth. That it might set up a domino effect of the loss of other teeth, and eventually get to the point where that would have to be addressed by something that's much more complicated than simply treating this one missing tooth.
Right.
But you know, you say it doesn't have to be done. Another example, you've got old amalgam fillings that have been in place in your mouth for 25 years. Clearly they're breaking down. I can tell that by visual inspection, by radiographic inspection, by photographic inspection. They're breaking down. But guess what? They don't hurt.
Right.
They don't hurt. So I can show you as I'm doing the tour of the mouth, Naren, it looks like a number of the, by the way, do you know how long these fillings have been in place? And oftentimes the patient doesn't know. It's like,
maybe 10, 15 years. Yeah. I have no idea.
Gosh, I think I was in maybe early 20s. And so then do the math. How long, you know, then that's been in place over 20 years in your mouth.
Right.
Right. And Naren, it looks to me clearly that we've got them breaking down. These things only last so long. Do you have any interest in addressing that? And we might say, but before you answer that, let me share with you a possible consequence of not doing anything. Decay can get underneath those fillings, and decay never solves itself. It only gets worse. And so while it doesn't hurt now, the decay can get to the point where it now starts to hurt, but it can get to the point where taking care of that will be much more complicated, perhaps a root canal and crown. Now, we can take care of it today more conservatively with fillings, but a possible consequence is that the future treatment becomes much more complicated by waiting until it hurts.
Right.
What I'm doing is guiding them so that they can have all the information so they can make good decisions about their oral health. And I really think, it was interesting when Paul had been through some training with Frank Spear, and really, really good clinical courses. And one of the things Frank talks about is always let the patient know about what the consequences could be in a non-scary, non-threatening way, just matter of fact, what could happen if they don't do anything. Paul started to incorporate that in our practice years ago. And guess what happened to our case acceptance?
Went up.
And not like a little bit. It went up geometrically. And, it was cool to see that result and to see people respond in the way that you knew you could help them. Thank you so much for watching this YouTube video. If you enjoyed it, be sure to click like. The full podcast episode link is below. Be sure to click that if you'd like to listen to the entire podcast episode. And most importantly, be sure to ring the bell to subscribe. That means every time we upload a new episode, you'll be the first to be notified. Thanks so much.